And before we get started with Dr. Teichmiller, I want you to know that if you refer any patients to his office, he is giving away a Visa $300 gift card to be drawn on December 22nd. You are not. You are ineligible.
I feel like an employee.
That would be good. You should.
That's good.
Your staff is fantastic.
Yes,
I got to
they
tell you, they are just wonderful over
They
there.
do a great job.
They don't say the thing about you, but I mean,
sure.
they are wonderful.
They do too. They love you.
They are
They've
wonderful.
actually been with you for a long time.
Most of them have, yes.
Yeah, that's a
And
lot.
you go over there, you want to get some glasses like I got, you want to be with the in crowd, they got a huge selection.
They do have a huge.
I'm a little hard to please, but finally he got me fixed up. So, you know, you don't get it. People just don't, I don't guess they get it right the first time they don't like what they got. I mean.
That's pretty rare, actually.
For my part.
Right. Yours
I didn't know what to expect.
Yours is a little more challenging because you didn't know what you were missing, and then you have a lot of different things you do. So, you know, the big thing there is a lot of people need more than one pair of glasses. And so that's what we try to educate people on is that, you know, one pair of glasses, just like one pair of shoes, is not going to service all your needs.
It's a very big part of your face.
And especially women like to have different glasses for different outfits and things like that. So not only from functional standpoint, from computer to distance to sports to reading, but just from fashion standpoint.
Yeah.
So I was a little hard to please.
Just a little bit.
Yeah, but you worked me
He's
in.
like a woman. He's a diva.
Yeah, well, you know, it kind of goes with.
Shouldn't shock us.
All right, you're going to be, you know, if somebody wants to get in for the holidays, they better hurry up and do it because everybody starts, you know, winding down as we get more towards Christmas and New Year's.
And I'm in the office through the 22nd. I just happen to go. We're going to go visit our kids out in California, but our office will be open the week after Christmas for 3 days, like 27th, 28th, 29th. Normal hours. If you need to come in, make purchases, pick up supplies, you'll be able to do that.
All right.
Perfect.
If somebody makes an appointment, and by the way, it's a short drive from, you know, I know we're not only just in Athens, but if you are in Athens, you're at 6th Avenue. I mean, it takes 15 minutes to get there, provided you get over the bridge okay.
Worth it.
And then go over there. Is it hard to get in to see you guys? I know it takes a week or two unless somebody calls me and I speed the process up.
Well, I think the biggest part of it is, especially when you call, that does help. But you know, we have several people that do call in at the last minute. They've gotten illness or sick or something like that, so they do have to reschedule occasionally. So we do have openings, so we can sometimes get you in within a day or two to fill those last minute cancellations. But generally within a week or two, we can get you in there.
Now the dry eye thing, I know you've taken some of the folks we know and you've taken them in and fixed them up. You're one of the few people that do that.
Right, and then you mentioned driving 15 minutes. I have people drive, 1 and 2 hours to come get this treatment. So they do come from far around because nobody else does it between here, Birmingham, and Nashville. I'm the only one that's doing it so far. And so it does give patients a relief because they've been suffering for this for a long time.
When you say relief, I wanted to stop you there. When you say relief, what kind of relief are they getting?
Quality of life. Their eyes just feel bad. So if your eyes don't feel good, you don't feel good.
Right.
And so either they're watering, they're burny, they're scratchy, they're just very uncomfortable. Some people to the point that they physically can't drive. I had several patients come in that said I literally had to pull over because my vision was so blurry because I couldn't see to drive.
Really?
And they just, because it's just either their eyes have gotten so dry they just can't focus well, or their eyes are watering excessively and they just had to pull over, and we were able to do the LipiFlow treatment.
How many people blame that on allergies? And it's really not allergies.
About 95%. It's very high. So everybody assumes, even if it's just one eye bothering them, they'll say it's allergies. I said, well, allergies are normally both eyes, and itching is the key symptom of allergy. So, and if you do have a dry eye situation, your allergies will be worse. And so in other words, you don't have enough tears to fight off all the allergens. And so a lot of times it goes hand in hand, especially here in the Tennessee Valley.
Right.
But you can fix them.
Well, we can definitely
Get
improve the
checked.
symptoms, right? So,
In a painless procedure.
right. So we can actually
spa.
do a couple of tests that actually evaluates their tear film, and I can tell them what type of dry eye they have. And it's like somebody would say, well, so you got dry eye. I said, well, you didn't hear me go. I said my eyes are watering all the time. I said, well, that's actually a type of dry eye where your tears overproduce because you're not producing the right type. So.
I want to talk about the other procedure that you have where you're molding and you're
Right.
sleeping with the
Right.
lenses
Right.
and you're not having to wear glasses throughout the day.
All right, that's pretty cool.
That is pretty
Yeah.
cool. That's really cool.
Well, I know that just for me personally, what I noticed is that even with contact lenses, sometimes my vision wasn't as clear and sharp as I wanted it to be. And so when I did this, it's like your natural eyes there. There's nothing interfering with your tearing. Your vision's sharp and clear, and you can see at all distances. So for children, it's really important because we're seeing an epidemic of nearsightedness. nearsightedness. I had a patient come in yesterday, and she said, we can't figure out why, my parents didn't wear glasses, but we wear glasses, our kids wear glasses, and now our grandkids are wearing glasses. And I said, it's because of this right here. You're all doing all this up close work. And so so what did your parents do? So they were out working in the field doing distance stuff all day. They weren't inside looking at a tablet.
Dirt looks the same.
It does the same stuff. So they weren't doing all this up close work that we're doing.
That's a very interesting point.
Makes a lot of sense.
Right. And so we're seeing an epidemic of that, but the general molding and CRT can actually help correct that. So by reshaping the eye, we do tend to slow down and sometimes stop the progression of the nearsightedness.
And you're literally sleeping with the lenses in your eyes.
So average
Go
7
ahead.
to 8 hours a night, and then you
Okay.
get up in the morning and take them out. And it, depending on the prescription, it can take, anywhere from 1 week to a month or so to get it fully corrected
Really?
all day long.
That's it.
That's it.
I wear glasses because they make me look smarter.
We need all the help we can get.
And I don't have to
Harry
wear reading
Potter.
glasses all the time, and I can see Mr. Potter.
Yeah,
That's
Mr.
right.
Potter.
Mr.
yeah.
Potter.
Mr. Potter.
Mr. Potter
But
to
hey,
you.
I love mine. You will too. So go over there and see Dr. Teichmiller. Innovative.
Hey, glasses can be sexy. Don't be fooled. Glasses can be sexy.
They can.
That's another reason I got it. I mean, I'm about, too sexed out for the, the over 40 crowd, but
Over 40.
working for me. I'm holding up good. And thanks for sponsoring the Athens Christmas Parade.
Glad to
Our
do
main
it.
sponsor.
Dr. Teichmiller, along with Traditions, and Mark Yarborough, County Chairman here, and a bunch of other folks like David, everybody are in it too. But the parade will start Friday night. It'll air Saturday, Sunday, Monday, a bunch of times, and then I'll be
your
here a couple of
DVRs.
days next week, and then I'll let you know I'll be taking my final time off for the year.
And we may have that Christmas story to share too.
Yeah, we'll talk about that later too. I may know more about that tomorrow too. That Christmas story produced by the church Shades.
Out for delivery.
Shades Mountain Baptist. Is that what it was down there?
It was.
Down in Birmingham.
30-minute short film.
Short film.
cool.
Anyway, Merry Christmas.
Merry
to you and your
Christmas to
family.
you
Y'all have a
guys.
safe trip to
Great.
California and back,
Thank you.
and we'll see you back when you return, I guess.
Sounds awesome.
All right, let me take a break. We'll be right back with y'all arm wrestling.
No.
David and Reggie.
Stupid.
Y'all hang on.